And we need to also relieve stress on our emergency departments. And let me tell you what's going on in our emergency departments, and this is rather surprising as well. Right now, too many New Yorkers are going to emergency rooms to get a test, just to get a test. We did 377,000 yesterday alone. We have capacity. We have 2,000 locations people can get tested. So please do not go to an emergency room and tie up the resources of those individuals so you can get a test. And don't come in if you have very mild symptoms either. I know you're anxious. I really understand this. But if you're an adult with very minor symptoms, you can handle a runny nose, you can handle the throats being a little bit sore, a little bit of cough. Just treat it as if you would have flu. Follow the protocols, but please don't overburden our emergency rooms. They have so much work to do. So when you look at the numbers, look at the number of people in the emergency rooms who've gone there only for testing. Nearly 5,000 people in the last 24 hours. Do you realize what that is doing to our healthcare system? Look at the region. Finger Lakes. Look what you're doing. Mohawk Valley, Central New York, these areas. What we're going to do is say, we understand there's a problem and you think that's your only avenue, the easiest avenue, but please do not do that to our healthcare system. Stay home if you have mild symptoms, but look at the stress this is putting on the systems that cannot handle any more stress, to have people occupying space in emergency rooms. So help us get the word out about this as well. And what we're going to do is say, in those situations, we are going to be deploying more test kits to the hospitals that have a problem. We know exactly where they are. We know where this is going on. And we'll redeploy staff, and we'll be making some more announcements on that very soon. We're working on operationalizing that. This information just came to light, and our immediate response is to turn it over to the experts here. And Commissioner Bray is already figuring out how to get the test kits literally to the parking lots of some of these hospitals, so people can, if they show up, they can test to there and not tax the resources of our hospitals. Really important to get that word out.